We roughly estimate that about a third of the people are receiving letters of recommendation and approval for primarily emotional or mental problems, and that cannabis is a unique psychotropic in this context, in that it has effects on both cognition and affect that also are inextricably connected with different kinds of physical functioning. For example, with anorexia, people get inadequate nutrition because of their anxiety causing a suppression of the appetite, and that when they receive cannabis, the nutrition is improved because the peristalsis and the spasm is relieved, peristalsis is promoted, so also evacuation, which then produces improved mood and improved functioning. With regard to cognition, this also includes people with thought disorders, and you might find this kind of unusual, but there are certain aspects of cognitive functioning that cannabis helps, like suppressing or decreasing obsessive thinking, and also paranoid ideation and paranoid delusional thought. Interestingly, the short-term memory loss that people experience when they acutely medicate with usually inhaled cannabis, they can't hold a paranoid delusion long enough. And the same goes for obsessive compulsive disorder, because they can't keep up this string of pathologic associations. Also, the modulation of affect also affects the cognitive behavior. With decreased anxiety, this decreases the pressure for this abnormal type of thought. I believe that a new category is warranted that cannabis fits, and that's easement. If you look that up in the dictionary, you'll see several meanings. And one of the main meanings is giving ease, not the property legalistic kind of passage or going on to some property and getting certain rights, but easement as a calming effect. And this is what I believe cannabis more closely approximates. It's not the same as a benzodiazepine, which produces sedation and, ironically, depression. There is no free lunch pharmacologically. So people do not like the benzodiazepines and other sedatives for these kinds of reasons, and cannabis helps restore emotional responsivity in a normal way. And this also goes along with people with their paranoid ideation and disturbance of interpersonal relationships. With certain people with thought disorder, they note that they're more able to relate to others, which then improves their self-esteem and their social functioning. You're never going to find this written anywhere because of the psychiatric literature being horribly biased. And I've looked through the APA publications going back maybe 70 years, and it all is tainted with the antisocial element and calling it dysfunctionality or character defect or other kinds of pejorative condemnatory terms. And it's all pill pushing. It's all medication. And to that end, we really don't know what is happening, and this extends not just to psychotropics, but I'm going to read you a short letter to John A. Kitzhaber, MD, Director, Center for Evidence-Based Policy, Oregon Health and Science University. And this is who I suggest if you want to contact to embarrass a little bit. On February 25th, I happened to view a panel presentation by your organization on C-SPAN on the cost-benefit study of different pharmaceuticals contracted by AARP. The sum total of that panel was they could not develop any cost-benefits analyses because in analyzing the pharmaceutical literature, they discovered it was all promotional rather than objective and scientific. So everything masquerading as science is not. So based upon California clinical experience with a range of chronic conditions, our findings indicate a significant advantage over other pharmaceuticals conventionally utilized because of improved quality of life and fewer adverse effects. Consequently, we request the opportunity to discuss our findings with you. Attached is a list of conditions. And guess what the response was? So I'm glad this is going over cable TV in the Portland area, and hopefully somebody out there in the viewing audience can give the center a call and ask them to include cannabis in their studies, and especially about the mental health issue. I would be fascinated to hear the response, but I won't hold my breath.
May I interject just very briefly? There's research I'm sure you guys are all aware of about the synergistic effects of the receptor effects of opiates and cannabinoids, where they basically are hitchhiking with each other, and much smaller doses of both medications create the same benefit with, of course, much less side effects. These are really remarkable findings, and I really regret that there aren't physicians who are just monitoring the reduction in the prescription patterns of their patients if they doubt that cannabis is useful.
You think that's new? If you read marijuana medical papers, in the Ohio State Medical Society meeting on cannabis in 1860, a Dr. Frommuller from Ohio reported that using an alternating courses of opiates and cannabis for treating chronic conditions reduced dependence on opiates. 1859 this was written. And so, you know, this is something new. No, we're talking about the takeover by Big Pharm and ruining policy through their special interest money. And furthermore, the fact that this whole system, can I use my favorite phrase?
Why not?
Monomolecular mercantile madness. This is all patent office driven. If you look back to what it was before the single molecule ascended to its role in current commercial medicine, you'll see that it's all secondary to what can get patented. And then they claim that the newly patented material is increasingly better, blah, 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 but then you see what's happened to the literature. It's gotten thoroughly corrupted and perverted so that you don't know what's happening. And here we have now a drug-seeking, drug-hungering public convinced that they need all sorts of combinations of patentable materials. And it's really sickening our society. And when they started directly advertising to the public, for psychotropics especially, ask your doctor. Social anxiety disorder, all these kinds of influences to influence you and their bottom line.
Any other questions?